Hi, I'm Brynn, and welcome to the AT Osteo Chronicles.
And I'm Jenna.
Today, we're going to talk a little bit about neck patterns. So, we've had clients come in recently, or I don't know, years,
Yeah.
that have generally seen other practitioners and they keep wondering why their neck pain is not going away or it comes back.
Yeah, so we got talking about it because we could see all over the internet and stuff. There's all sorts of TikToks and Instagrams and all about how to fix the neck and how to fix the neck hump and all this kind of stuff. And we were talking about how that's all fine and dandy, but the reality is that most people aren't getting any real relief from their neck pain. And so we've decided that we're going to have a talk about it today to talk about the common patterns that we both see that can lead to neck pain that aren't necessarily the root cause in the neck. And why that might be the reason why you go to all these different therapists trying to find an answer to your problem or answer to your neck pain.
Yeah, so I would say the one that was for me as a student when I first saw you for the
Oh,
first time,
yeah.
way back when, we're not going to throw years out there.
Yeah.
Don't want to age us, was coccyx.
Yeah.
Coccyx, a relationship where if you had fallen on your tailbone, that shifted the spine
Mhm.
and created the pattern all the way up to the top.
Yeah, and there's a couple of ways that we can look at that. We can look at that from the Lovett brothers connection. Do you know that chart where it's like if there's something going on at the top of the
Mhm.
spine, you've got a mirrored issue at the bottom of the spine and it goes up like that,
Different levels, yeah.
different levels. And then also too, when I went through my osteopathic training, and then dived even further into the neural manipulation, the reason why working the coccyx for the neck, not only from a spinal perspective, it's also the dural tube that goes from the sacrum right up into the skull. And the cerebral spinal fluid flows along that line, that spinal cord. So if there's been any falls on the sacrum or any whiplashes or anything like that, it can put tension on the dural tube and it can hold people in tension in through the neck. And it might be from like a fall on the tailbone. Yeah.
Yeah. So it's pretty simple and it's crazy to see because we can do what, a small release on the tailbone over
Yeah.
clothing,
Yeah. Overclothing.
and we can even see the sacrum, the rest of the spine balance out all the way up to the neck. So when we go to assess
Yeah.
the neck, it will sometimes correct it.
Yeah, I mean, I like if you've been a patient of mine, you've probably experienced some of this, but there's lots of times where I might use a leg length discrepancy and I'll use that as information to determine is it coming from the sacrum or is it coming from the neck. There's different ways that you can be paying attention to that, so you can be looking at it, and it's not going to be an exact science. We're just always collecting data from people, right? It can shift and change. Muscles will pull everything out of alignment. People go back in their car. By the time they get home, they're sitting on a wallet, all the things. But in session, we can in real time, we can see if we make an adjustment at the neck, how that changes the leg length. Now, that person might not have neck pain, but maybe they have low back pain, but it's because of their neck. And it's the same thing when we're working the tailbone because somebody has had neck pain. We also have the musculature that comes from the neck all the way down the spine. And so osteopathically, we look at the whole body. So if somebody comes in for neck pain and I know from their history, and this actually just happened last week, they've seen a chiro, physio, massage, acupuncture. Sometimes it's helpful, sometimes it's not, it's temporary. Whatever, for whatever reason, they end up in my office. I'm palpating scalenes, which I know you do too.
Mm-hmm.
And so if the scalenes are really tight, maybe their breathing is being affected. And we did a talk on breathing mechanisms not long ago. And so if their breathing mechanism isn't as efficient as it could be, and maybe they're more of a shallow breather, a chest breather, a breath holder, and this happens a lot, then they're going to get tension in the neck, but it's actually from breathing. So that's one way that I might be looking at unresolved neck pain, is I'm actually looking at what else is being affected, what else do those muscles do, where do they attach, what are those attachments points doing. So that's one way that I look at it.
I would say that one of the things that I do to tell the difference is when I assess someone's spine standing and seated. When they go seated, if things start to correct, there's probably a lower body issue that's causing those upper chain lesions.
Yeah.
So that's another way to test. So it's something that you guys could do too. If you were sitting in front of a mirror, you can look at the level of your shoulders, place your hands on your hips. And if that changes when you're standing, like one side higher, and then you sit and it goes level, that means it's more likely a sacrum, tailbone, lower body problem going on.
Yeah.
And then if you still have some stuff going on, you may have other stuff up in the upper body too.
Sometimes it's like two different problems.
Yeah,
right?
Yeah, nice. Then you might need to fix one before you fix the other. Yeah.
Yeah. Sometimes I find people who use their hands a lot. So it could be mousing, it could be cycling, especially road cyclists, because they're like this, and then their neck is tipped.
Yes.
So I find there's a grip to scalene issue. So I'll check whether or not they're like, it's a thumb and pinky. It's not like power.
Yeah.
We're not looking for power. Just a neuromuscular type of assessment, and feeling like if there's any kind of weakness in through the grip, especially thumb and pinky, oftentimes from a fascial perspective, from a nerve perspective, it comes all the way up. So I'll actually check the scalenes for a grip, and that will often clear up some restriction in through here if that's the true cause. And then that will often feed into the breathing mechanism that I just mentioned as well. And that might play a role too. And so a lot of times the homework that I give has other areas of the body as part of the homework, not just the neck.
Yes.
Yeah.
I would say that if you're going to keep going with scaling, another one I find is if you have low back and neck stuff going on, it's the QL.
Yeah.
So the scaling, which are both lateral stabilizers, so that holds your body from going off to the side. Yeah.
Yeah. And what else do I find with unresolved neck?
Do you want to know a crazy one? I had a woman who came in and it was her PCOS.
Oh, so this is gonna be more of a visceral.
Yeah, so it was PCOS inflammation that was actually causing her neck pain. And once we resolved that, it went away completely.
Yeah. So there's a couple of theories. So for people who wouldn't completely understand how and why that might happen. So there's a couple of things that we could think about there. So I wish I had my posters with me.
Next time.
I should give them to you.
Yes. We're there. Send them to me and I'll throw them in the video.
Oh my gosh. Ultimate editing there. So we have what's called our intrinsic core. We talked about this before. So we have our pelvic floor, our diaphragm, and then our jaw. There's more to it than that, but that's just the basics. So when I'm thinking about someone with PCOS, I'm thinking about uterine inflammation, ovarian inflammation, like just inflammation through the reproductive organs, which can have an effect on the pelvic floor.
Which also attaches to the coccyx.
Yeah. And then it can also change a pressure differential between like the diaphragms. We have these diaphragms, and each area, when we're taking a breath in or a breath out, there's different pressures that happen, right? The reason why we have these diaphragms is to keep things contained when we're taking a breath in, a breath out, when we're having to hold, bear down. If you're a power lifter, you're holding your breath when you're doing your lift, all those kinds of things. It changes the dynamics of pressure in your body.
I would also say moms who have given labor.
Yeah.
That will also throw off your pelvic floor diaphragm, which can therefore affect your coccyx.
And then ripple effect up into the neck. Yeah.
Yes.
Yeah, definitely done that, which is
Personal,
personally
personal story here.
and in session. Yes. I'm trying to think of the other unusual eyes to neck. So the visual, yeah, so the visual system's tied into the suboccipitals, and it's one of those things. I think I've got one on my YouTube channel. But if you place your hands on your suboccipitals just lightly, it doesn't have to be too deep, and you move your eyes around, sometimes you can actually feel the muscles in the back and the base of the skull um, contract a little bit.
Ooh, you're right.
Yeah. So
It's more on one side than the other for me. So I probably need some work there.
So, for people who've had a car accident, I see this a lot. Office workers, people who are at the computer a lot, and so the suboccipitals do that tiny little head movements. The bigger head movements are a different set of muscles, but the tiny little head nods are those small muscles in the base of the skull, and they have a relationship with the eyes. And then also the optic nerve goes right through, crosses in the middle, and comes out over here. So people who fall and hit their head back here often will have some visual symptoms.
Yeah. Trying to think if there's anything else. The only other thing that I think I've noticed is when people have really, really tight SCMs.
Mm,
So that's the muscle that goes through here. That will also affect your vagus nerve. So if you have
yeah.
digestive issues or stressed, your vagus nerve is something that will get irritated and that SCM can tighten up.
Yeah. Like what else? I mean, I'm sure there's probably lots of other things. When you start to pull the anatomy apart and you're looking at synergistic muscles, antagonistic muscles, kinetic chains, fascial chains, there's lots of different ways that we can look at what can contribute to neck pain. So there's always a physiological reason, something anatomical, structural, or whatever. But that's what we do is we go when we're actually trying to figure it out and see. And there's so many different types of assessments. So from an osteopathic perspective, we might do like a general listening, and there's different terms for what we're feeling, but basically we're just feeling for a somatic dysfunction and where the fascia is pulling us towards. It could be movement. Yeah, it could be breathing. Yeah, there's lots of different ways that we can look at it.
Yeah, and then I would say that I know a lot of people think that their posture is what can make the neck worse, but I think that a lot of it is that your neck is already weakened from those other things we talked about. And then that forward head posture just exacerbates the symptom.
Yeah, I mean, and the thing with posture is that certainly poor posture can lead to neck pain. But not everybody with poor posture is going to have neck pain.
Yes.
As well. So it's everybody go, oh, I should just fix my posture. Well, maybe there's lots of benefits to fixing your posture, but it
Yes.
might not be the reason why your neck is sore.
I think that's the best way to describe it. It can contribute, but it may not be the cause. Yeah.
Yeah, for sure. I'm trying to think of anything else. I know a lot of people talk to me about pillows. That is maybe something we can address another day.
I'm still trying to figure out finding a good pillow. So I don't know how much I'll be able to.
No, and what I tell people, so here's a personal story. I bought a new bed and it was a softer bed. So my previous bed and pillow were both uh, slightly firm. Changed my bed. My pillow I didn't change. I was in the worst pain of my life. I had such bad neck pain, I didn't even know what to do with myself. I just woke up and went, oh no, this is what this feels like. It was terrible. And it didn't take me that long. It took me probably about a week to try and figure out, like, I don't know what's going on. And I realized that the firmness of my pillow no longer matched the firmness of my bed. And as soon as I changed the firmness of my pillow to match the firmness of my bed, my neck was in better support, and I cleared my neck pain at that time. And it was just I never would have thought that that would be a contributing factor.
It makes sense though. Keeping everything balanced, then your body knows how to deal with it.
Yeah. And it was like a memory foam pillow. It was a nice pillow. It had a big curve, it had a little curve. Like, it was a nice pillow, but it just did not, it just didn't fit the mattress anymore.
Ooh, you know what I just realized? As a woman, many of us may have this issue, but I will carry my stress here. So I find that if I'm stressed out,
Yeah.
I will do this, and then my neck pain gets worse.
Yeah. Yeah, absolutely.
And breathing really helps with that.
Yeah. Also for the women, making sure that you have a strong bra or sports bra that's not digging right into the shoulders, because of course your upper traps go all the way up into here, right? And so you want to make sure you're taking some pressure off here. Same thing if you are carrying a heavy backpack, or if you carry, so a lot of people do a side bag, but yeah. So
I'm watching my shoulders too.
I know. And so if you have a heavy bag and you're only putting on one side, do try to switch it to the opposite side. It feels super weird. Your best bet is not to put any bags on your shoulders.
Mm.
And if you're going to put something on your shoulders, go the backpack route, but then not as much weight. Easier said than done, but that could be also a contributing factor as well. I have had people with hip flexor and neck pain, and that comes up when they're hiking.
Oh,
Yeah. Yeah. So again, part of just, I think, the kinetic chains pattern, they're looking down while they're hiking, so they're not tripping on like twigs and rocks and tree roots. And so if you're looking down while you're like hiking up, you're changing the biomechanics of your neck.
yeah.
Yeah.
So I think the biggest takeaway is the fact that if your neck pain is coming back, it's probably starting from somewhere else. And it's good to go and get an opinion on it.
Yeah, or like an assessment, just, or ask your provider if there's anything else in your history that could be contributing to the neck. Um, as patients, sometimes we forget to give our practitioners all the information because we don't think it matters, that it's not pertinent information. A huge part of osteopathy is taking a really in-depth history. So I always tell people all information is good information. And if we don't need it, we don't need it, but at least we have it in case we need to take a step back and go, wait a second, we have to look at this from a different perspective.
I will say that there is some people where I'm like, there's just too much history. We're going to start from friends here.
Yeah. 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 I'm like, just give me all the history. Yeah. Yeah. So if you have any questions specifically about different types of relationships, like neuromuscular relationships related to the neck, if there's anything that we've talked about that resonates with you, if you feel like you want to get in touch with us, of course, Brynn is in Burnaby and Port Coquitlam. I'm in Victoria and South Surrey, and Burnaby.
Yeah, don't forget that one.
Yeah. And yeah, so you can talk to your own practitioners, or you can reach out to one of us if you live close to us, just for an assessment and just getting a second opinion, because there might be something there that could be really useful. That happened in my session last week. She'd had this particular pain for ages and ages and ages, and it was actually super simple. I don't want to jinx myself, but anyway, it was a scaling to grip. There might have been a scaling to QL, maybe on the other side of the body, something to do with the breathing. And it all just completely made sense because she was a breath holder and, whatever her history was. And she just was like, oh, like, I'm like, nobody's actually ever explained this to me before. I'm a chatty Cathy in my sessions.
Me too.
I explain everything. You want me to or not?
Yes. The more questions you ask, the more information I will give you.
Yeah.
Yeah.
Yeah. So reach out if you have any questions. We hope that this information has been helpful for you. I think what you'll have noticed by now is that our intention isn't just to give you like random exercises, try this, do that. I think there's lots of information and a lot of it is, quite useful. We always want to come in with a little bit more of a different perspective, something a little bit more educational, something to make you really think about what's going on in your body.
Yes, and just really have you looking for something else that it is possible. There's stuff out there that can help.
That can help. Yeah.
Yeah.
Awesome. Great.
Thanks for joining us.